Hey everybody, this is Beth Durinsky from Odyssey Insurance and Investments, and you're listening to the podcast, Real Insurance Made Simple. As a working mom of young kids and a small business owner, I know firsthand life happens. So come along with me and learn how your insurance policies work when real life happens and you need them most. Hello, everybody. Welcome to the first episode of our Medicare mini-series that we're going to be doing. Each week, we're going to work on doing a little bit of information rather than throwing a bunch of information at one long podcast or episode because Medicare, let's be honest, is very overwhelming. We're going to start off with going through the differences between Part A in one episode, Part B in another, Part C, Part D, and supplements. And then we're also going to kind of trickle in some other things like how Medicare works with a nursing home. Maybe we will also speak with an elder law attorney. I believe we are also working on an interview with someone who coordinates silver sneakers with places like the YMCA. So lots of fun things coming throughout this mini-series as it relates to Medicare or how your Medicare coordinates with other benefits outside of that. So please keep an eye out for these. And I hope you find the information helpful for your Medicare journey. So we're going to start out with a little bit of general lingo so you understand and know some of the terminology I'm using, because I do feel like that is half the battle with understanding Medicare. The first piece of lingo or terminology we're going to look at is Medicare beneficiary. A lot of times when we hear the word beneficiary, we don't think of ourselves, when in reality that really means the person who is receiving the benefits. So when we think of a beneficiary, we typically think of leaving something to someone, kind of like a life insurance beneficiary. If we have life insurance, we are leaving that to someone else, not ourselves. However, as that relates to Medicare, you are the Medicare beneficiary because you are the person receiving the Medicare benefits. So when you are referencing your own Medicare plan, you are in fact the Medicare beneficiary. The next term we're going to look at is premium. Premium is the cost you pay for something. Your monthly cost or yearly cost that you will pay to receive those benefits for that particular plan or part of Medicare. The third term is going to be the deductible. The deductible is the cost that you will pay as the Medicare beneficiary first before Medicare or one of your alternative options or private options kicks in to pay their portion. So the deductible is the part that you will pay first as the Medicare beneficiary before your Medicare plan or private plan kicks in. Next, we have coinsurance and copayment. This would be your responsibility as a Medicare beneficiary for certain procedures or certain services that you receive under Medicare. A coinsurance is going to be a percentage that you are responsible for, like 20 or 30%, while a copayment is going to be a flat amount, like $20, $50, $100. I should also clarify that the copayment or the coinsurance usually comes after you have already satisfied your deductible. The final piece of terminology we're going to go over for today's episode is going to be enrollment periods. Each time you go to enroll in either your traditional or original Medicare Part A and Part B, or a supplement or Part C or Part D, you have to qualify or be eligible for an enrollment period. This is the time frame that you are allowed to enroll within one of those aspects of Medicare. All right, now that we have some basic lingo down, let's hop into Part A, our first true episode, starting off this mini-series on Medicare. So what is Part A as it relates to your Medicare coverages? Part A is what's called hospital insurance. Generally, your hospital insurance is going to cover your inpatient care in a hospital, some skilled nursing facilities, some nursing home care. We do have an upcoming interview that will be posted later on with a nursing home director by the name of Brooke, who is going to provide all kinds of insights for us on what that looks like, on how Medicare translates to coverage and how it pays when you are in a nursing facility. But back to what does Part A cover? It also covers hospice care and home health care. So again, inpatient care in a hospital, skilled nursing facility, some nursing home care, hospice care, home health care. So when I utilize these coverages, what are my costs with Medicare? I do want to preface that these costs are for someone who only has Part A, usually in coordination with Part B. They only have coverage from their red, white, and blue Medicare card. These costs are not necessarily the same for someone who chooses to purchase a Medicare supplement or a Medicare Advantage plan. So keep that in mind. We are talking just Part A costs at this time. With Part A, you have your Part A deductible. This deductible is for a benefit period, which is a 60-day benefit period. I am going to go ahead and give you some actual numbers for examples, but I do also want you to be aware that these deductibles are subject to change each year. For the year 2024, the 60-day benefit period deductible, Part A deductible, is $1,632. During this time period, when you're in your deductible phase, your cost per day in the hospital or as an inpatient would be $0 per day. When your inpatient stay reaches day 61, you then have a per day rate of $408 per day. This is for days 61 through 90. If and when the inpatient stay reaches day 91, you also have an increase in per day cost to $816 per day. But this is your per day rate for your lifetime reserve day. And this can get a little tricky, so I do encourage you to reach out to your local agent if you're looking for more information on that lifetime reserve as it relates to your per day rate under your Part A coverage. As a reminder, all of these numbers are subject to change each year. So in 2025, the Part A deductible and your daily rates are subject to be different. Please contact your local agent for more information on when those rates change and if they have changed. The next question I typically get asked is, what will Part A cost me? Typically, Part A is going to cost you $0. It's considered premium-free Part A. Premium-free Part A applies to all of those individuals who have worked at least 40 quarters, also known as 10 years, because over the course of your employment, you have paid into your Medicare Part A coverage. So now you have earned your Part A premium-free benefit. This also typically applies to a spouse whose spouse has worked, meaning maybe you are a stay-at-home mom while your husband worked. If you do not qualify for premium-free Part A, it does not mean that you cannot obtain Part A coverage. It just means that you would have to pay a premium per month for those services. If you worked less than 30 quarters in your lifetime, you will have a certain premium cost. Or if you worked between 30 and 39 quarters in your lifetime, then you will have a different premium cost. And these are also subject to change every year. So I'm not going to hit on those current premium A costs if you do not qualify for $0 premium-free Part A, but encourage you again to reach out to your local agent if you are inquired or worried about that for any reason. Next, I get, when do I apply for Medicare, or do I need to apply for Medicare? So that answer is, again, it depends. I typically tell clients they want to start paying attention and being on the lookout for their Medicare or the possibility of having to apply 3 months prior to turning 65. So if you are already receiving Social Security or railroad benefits for at least 4 months prior to turning 65, you should automatically be enrolled into your Part A and most likely Part B coverage, which we will talk more about on the next episode. On the other hand, if you are not already enrolled in receiving your Social Security or railroad benefits, then at that time you typically do need to go ahead and apply for your Part A and or Part B Medicare benefits with the Social Security office. Again, I usually advise my client that this process starts at least 3 months prior to when you turn 65. Of course, if your birthday falls on the first of the month, you may have an additional month prior to. But the overall enrollment period into Medicare Part A is going to be 7 months. It's going to be 3 months before you turn 65, the month you turn 65, and goes up to 3 months after you turn 65. In summary today, we've touched on what does my Part A hospital insurance cover? What are the coverages or costs as it pertains to me for Part A? What will Part A cost me? Do I need to apply and when? Overall, I hope you found this general overview of Part A hospital insurance as it relates to Medicare helpful and informative. Have a wonderful and blessed day, everybody. Thank you all for listening today. We hope you found this episode helpful and informative as you navigate the world of insurance. As a reminder, this podcast is never for legal or professional advice, and you should always consult your local and licensed insurance professional. We wish you a week filled with love and blessings from the team at Odyssey Insurance and Investments.